I want to show you where I think simulation fits in the patient safety diagram. All right, and this is meant for like hospital leaders to show a demonstration of how this all fits together. Every hospital has quality and safety risk intelligence or data. That data comes from many different sources. It comes from what we know the providers did, the quality of the doctors and nurses caring for the patient. We know if the patient got better or worse in our hospital. When nurses and physicians report incidents and problems, all of this feeds into this data system. We know the cost of taking care of the patients, and we know the cost of running the hospitals, right? President Lee knows the cost of running a hospital very, very well. Then there's external outcome measures. So some other people might be measuring what we're doing. Insurance company, the government. Accrediting bodies might have something to say. If you're a JCI hospital or you're some other accreditation through Taiwan, they're giving you feedback on where they think your problems are. Latent threat identification means where are the problems in our hospital that we don't even know yet? Okay, where are they? Where do they live? And then all of that data lays on top of how do we improve? How do we get things better? Okay? And we get things better with policies and process. We get things better with quality and safety education. We get things better with cultural competencies. This means how do we work better together? What kind of behavior do we allow to happen in our hospital or not? And we kind of think about these educational efforts as sometimes individual things that happen on the routine basis, individual things that happen emergency basis, okay? Then individual things or team things that happen on the emergency basis, so emergency response teams. Then there's other things like, let's say, elective surgery. It's a team function, but routine. I hope you're starting to see now where I think simulation fits. It fits right in that area right there. Because simulation as an education tool can touch many of these things. Notice it doesn't cover everything because it's not the only way to educate people. We want to say, but when it is the right way, this is where it sits. But notice, for my talk later on, that this also sits on top of this one. Latent threat identification, so that we can tell the hospital system, tell the leaders where the problems are in our hospital, so they can invest the right resources to make things better. So this is my model of where simulation fits in a big health system, in a big hospital or big health system.